Emergency healthcare continues to pose a major challenge for the health sector. The Philip G. Pierre administration recently opened the Dr. Betty Wells Urban Polyclinic under the Dr. Winston Paris Medical Complex, formerly the Victoria Hospital, to redirect services and free up space at the main facilities. The government also plans to construct an additional wing at the OKEU hospital to address emergency healthcare issues.
The government in 2025 will expand the emergency facilities at the Dr. Martin Didier Polyclinic in Grosley and retrofit and reintroduce services to the public at the former emergency ward at Victoria Hospital. In 2025, work will commence on the fifth wing of the OKEU hospital.
The debt-saddled healthcare system has also been hampered by supply chain snags in procuring medication and delivering quality care to patients. Prime Minister Pierre alleges that his administration inherited a debt of $79 million from the previous government due to local foreign healthcare providers and suppliers of medicines.
In 2024, an injection of $15 million into the OKEU was government's latest response to alleviate some of the challenges being experienced by this institution. The $15 million was used to clear a mounting backlog of payables that was threatening OKEU's ability to secure medical supplies. Of this amount, 10 million came from the CIP program and the balance of 5 million from the consolidated fund. Notwithstanding this recent government intervention, there remain significant amounts owed to local and private suppliers and healthcare providers. In 2025, we'll continue to reduce this large debt in an effort to make medical supplies and equipment available in a timely manner to the public.
The Prime Minister again appealed to citizens to adopt healthy lifestyles to help the strain on medical personnel and the system.
While this government recognizes the need to provide for primary and secondary health care, the sustainable good health of our nation requires the adoption of healthy lifestyles that embraces physical, mental, and emotional well-being. In 2020, 79.8% of deaths in St. Lucia were attributed to chronic non-communicable diseases. This statistic speaks to the need for our population to adopt healthy lifestyles, changes in our diet and social interaction, and physical exercise. We need to work together to implement strategies to reduce stress in the workplace, at home, and in the communities so as to maintain the mental wellness of our people.
The government, according to the chief executive, will strive to enhance free medical services to citizens despite the growing cost of healthcare. These include ultrasounds, mammograms, and free cancer screenings for men and women. Government officials remain optimistic that the recently opened Dr. Winston Paris Medical Complex will provide a range of health services to serve the Castries Basin and beyond as the government works to upgrade and increase health infrastructure. Gina Filippi, HDS News Force.